Hello, everyone. This is Jonathan Marks again from Go2Health Media. This is video 5 in our series, How Project 2025 Will Change Healthcare in the United States. Project 2025 is the 920-page conservative agenda set by the Heritage Foundation to be implemented if and when former President Trump wins election in November 2024. You can see the complete list of videos we are producing in this evidence-based series. Our intent is to educate you with facts. We hope you will like our videos and subscribe to our channel. Today, we are focusing on the impact of Project 2025 on Medicare and Medicaid. Thanks in advance for your support. Let's begin with facts about Medicare and Medicaid from Medicare.gov and Medicaid.gov. First, some Medicare facts. 66 million people in the U.S., that's 20%, get their health coverage from Medicare for those 65 years and older or with a disability. A new drug law went into effect January 1, 2023 that helps people save money on prescriptions and vaccines. A first headline is that we are experiencing lower costs for insulin, capped at $35 per month. According to the American Diabetes Association, 11% of the U.S. population is on insulin. That's 8.4 million people. Starting in 2025, out-of-pocket costs for prescriptions will be capped at $2,000 per year, and you can pay those costs on a monthly basis over 12 months rather than when they occur. Medicare is now able to negotiate lower drug prices. 10 drugs were selected in 2024. 15 more drugs will be selected in each of 2025 and 2026. And 20 even more drugs will be selected in both 2027 and 2028. Manufacturers that don't follow these guidelines will pay a tax and penalties. Now, let's discuss Medicaid. 88 million people in the U.S. are enrolled in Medicaid and CHIP. CHIP is the Children's Health Insurance Program. 44 million children are on CHIP. That's half of the 88 million people on Medicaid. CHIP is provided to children and families who earn too much to qualify for Medicaid, but not enough to buy private insurance. Medicaid is a joint federal and state program that provides health coverage to low-income individuals and families. These are basic facts about Medicare and Medicaid which will inform you of the impact Project 2025 will have on both these services. We want to cover 4 important points. 1. Project 2025 states, and I quote, Medicare and Medicaid combined cost $17.8 trillion, while our combined federal deficits over that same span were $17.9 trillion. In essence, our deficit problem is a Medicare and Medicaid problem, unquote, from page 283. That is what is called a correlation, 2 things happening together. Medicaid and Medicare do not by themselves cause federal deficits. Let's take another example to show how foolish this assertion is. Let's take crime, for example. 45% of crime takes place at night. That's a correlation, 2 things happening together. Does nighttime cause crime? No. According to the logic of Project 2025, if we want to reduce crime, we should get rid of nighttime. That's a ridiculous assertion, the same as Medicare causing deficits. 2. Project 2025 claims, quote, states should be the primary regulators of the medical profession, unquote, page 450. That causes 3 significant problems. First, with states being the primary regulators of healthcare, we will end up with a patchwork of state laws and coverages, such as we see in this current map of abortion laws regulated by states. Second, state tax revenues vary widely, and the ability to provide medical coverage without federal assistance means the quality of healthcare you receive depends on the state where you live. We are the richest country in the world. Why shouldn't we all receive the same quality of Medicare throughout the United States? Third, the states do not have apparatus built to automatically take up regulations of the medical profession. What we will end up with is each state devoting its own resources to provide an uneven level of medical care and duplicate the bureaucracies that can be more efficiently managed at the national level as a whole. 3. Quote, Medicare and Medicaid operate as runaway entitlements. Unquote. Page 462. If you or your family need support due to your age, disability, or low income, your medical needs are not runaway. They are legitimate needs. Project 2025 is judging what your needs are from their own political bias. 4. Project 2025 states, and I quote, add work requirements and match Medicaid benefits to beneficiary needs. Clarify that states have the ability to adopt work incentives for able-bodied individuals and the ability to broaden the application of targeted premiums and cost-sharing to higher income enrollees. Unquote. Page 468. What higher income or able-bodied individuals are we talking about that receive Medicaid? Medicaid is offered to those with disabilities or over the age of 65 or children or those with low income. Work requirements for these populations make no sense. This position underlines Project 2025's bias toward reducing federal benefits to millions of U.S. citizens without rational evidence on what is best for health care in the United States. Thank you for watching. We hope this brief video gives insight into how Project 2025 will change healthcare in the United States. Please like this video so more people see it. Thank you in advance. And please subscribe to our YouTube channel so you benefit from all the videos in this series. This has been Jonathan Marks with Go to Health Media.